Hi guys, it's Dave. This morning we're going to talk about thyroid disorder or hypothyroidism, which is a low thyroid. One of the ways that this can happen, or not one of the ways this can happen, but some of the things that you can see with this are weight gain, fatigue, muscle and joint aches and pains. Sounds like just symptoms of getting older. Depression, hair loss, especially in women, when you see literally clumps of hair coming out, brittleness in your nails, or if you're suddenly having issues where you're feeling cold all the time. Now, don't freak out. Some people honestly are cold all the time, period. It's not a thyroid issue, it's just about your metabolism in your body. But if you're seeing couple of these happen, especially if you haven't had it happen before, you need to go to your provider, get things checked out, because the sooner you can get on top of it, the better. What they will do is they will run a TSH, which is a thyroid stimulating hormone test, and that will tell you how much thyroid stimulating hormone is in your body, if you need to be on a thyroid supplement. Now, there are several out there. The main one that's used is called Thyroid, which is the brand name. There are generics for it, levothyroxine, which are much cheaper. There's also Armour Thyroid, which is a different type of thyroid supplementation. It's called a desiccated, is a big word, thyroid, but it does have two different types of thyroid replacement in both T3 and T4. Where Synthroid is just T4. NP thyroid, it's kind of, I don't want to call it the generic, but it's similar to Armour Thyroid in that aspect. That's another supplement that's out there. And then liothyronine is another one that your doctor may consider putting you on depending on your symptoms and your blood levels and tests. One of the important things to remember if you're put on Synthroid or levothyroxine or Armour Thyroid or NP Thyroid is you need to take them, they're once a day, and you need to try and take them first thing in the morning on an empty stomach with a full glass of water. I know, especially if you're a mom, that's hard to remember. You got kids going to school, you got things going on in the morning. If that's the case, it is okay to take it later in the day, like around 3 or 4 o'clock. But again, it needs to be consistently at that time, 3 or 4 o'clock every day, on an empty stomach again with a full glass of water. If you're put on a thyroid medication, or if your dosage changes, what you will expect to see is you can see differences in your weight, either gain or loss, depending on if your thyroid is working too much or not enough. Again, if it's not enough, you will have weight gain. And you will also see differences in your energy level. But if they put you on a thyroid medication or change your dose, you do need to go back in to see your provider in about 6 weeks to have that blood level checked again to see if it's in the right area. If they don't check that, give them a call and get that lined up, because without checking it, you could go for weeks, months, even years, not knowing if you're at an effective level for your thyroid. The other thing that they can look at if they're doing a lot of blood work is they can actually break out that TSH, where that one looks at both the T3 and T4, which are thyroid hormones, and they can actually break it down and do just a T3, because maybe your 1 level is okay, but your T3 might be low. You still would have problems, but you would not respond as well given the drug Synthroid. So that's something else that if you're still struggling after you get on it and you're going, man, my hair is still falling out, still have fatigue, I'm a little bit depressed, check with your provider about that too, because they can break that down and do a little more thorough investigation and break those out. Okay, the other thing important to remember when you're taking a thyroid hormone is your body also may be needing something else as well, which is why you're feeling run down too. So a stress B complex vitamin would be a good idea for you. Don't take it at the same time, but do again add that to your diet, taking it once a day along with your thyroid, but at a different time.